the link at the end. Okay, so in our new exam, I'm just going to start to enter some probe scores for Luke. The last time he came in, which was yesterday, he did pretty good, but today, let's just say things have gotten way worse. So we're going to enter quite a few numbers. One thing I want to point out is the site that you're about to probe, it's highlighted in yellow. And down here on bleeding and separation, you're going to see that the yellow is highlighted on the site that you just finished probing and entering a number for. So if you notice as you're entering that next site's number that you see bleeding or separation on the site that you just finished, you can use your keyboard actually to notate that by clicking B, will mark bleeding. And if you click S on your keyboard, that puts separation on there. And then you can continue to enter your probe depths. And again, it's always one behind. And then you can continue on. So I'm just going to fill all of these in. I'm going to show you a couple other things that you might want to switch when you're doing this as well. The top right here where it says script, if you click the drop down on that box, you can switch. You're going to probably be on the Dentrix default script, but you can go to other scripts if you want to tab through those sites easier. Like, let's say the Dentrix gingival margin. Let's click on that script. That puts you right on the gingival margin line. So if you have areas of recession, you can tab through this quickly and mark those areas that you have some recession on, without having to single click on each site and move around. So again, that was done using the script change right here. It's important to note that it'll stay on the last one that you're on, so when you go back to do a new exam, you're going to click on the Dentrix default script before you do your next exam. A few questions that I hear commonly asked questions. What if I have a site that is higher than a 9? You can be on that site and type in the number 9. And you can use either the arrows on your keyboard or you can use the arrows on this pad on your Perio data entry panel to increase it. What you're going to find that when you do that is you're going to see a greater than symbol in that site instead of the actual number. A few other things to note about this. The Perio panel itself over here, if for some reason this gets closed or you don't see it and you want to know how to get that panel up, you simply go to View from the menu at the top, and you're going to click on Perio panel. All you have to do is single click on it, and that Perio data entry panel will be up. Now I want to talk about the 3 tabs at the bottom. So we're on the data entry tab, but I want to go down and talk about the exam information one. So the exam information is attached to this specific Perio exam as a whole. So a lot of hygienists will add this information into your clinical notes, and that's great, wonderful, absolutely. But you can additionally attach this information to the periodontal exam itself. So there are some templates. This is the default one that comes, but what I like about it is you can click on each area and there's a drop down available for you, and you can make your changes there. So if you come down to oral hygiene, same thing, you can tag your calculus, plaque, and stain, light, moderate, or heavy. If you come down to x-rays, what does it reveal? Maybe you've got some furcations going on, as well as the periodontal case type. So you can tag it in this area as well. And then, of course, you can make your own miscellaneous notes. You can insert the date line and type whatever you want. So that's pretty cool. Once we save this exam, this information will be saved with it. If I come down to summary, I love this because so often you'll have patients ask you a question like, how many teeth did I have that were over the healthy, range? How many were over 4 millimeters? You can look right here on this summary tab and see how many teeth there were that were between 1 and 3 millimeters, how many teeth were between 4 and 5, and how many teeth were 6 or more. Again, this will help you when you're determining your even just your treatment, your case for this patient, knowing how many sites there were. Of course, bleeding, everything is going to get summarized for you. It'll also tell you your average probing depth in each sextant of the arch. So kind of a cool thing for you to be able to have all that right at your fingertips without having to count. So again, for those of you who were just joining in, the things that you guys missed, we talked about the site that you were probing. You're always one behind. The bleeding and separation, the yellow is highlighted on the site you just finished entering a number for. And if you use B on your keyboard or S on your keyboard, you can quickly enter bleeding and separation for the site you just finished and then continue with your scores. So once you've finished your exam, and again, I'll go back to the data entry tab if there's anything you need here. A couple other things I do want to show you. The plaque mobility and bone loss, this area right here in the center of your screen. So when you are on a single tooth, you can tag the mobility for that one tooth. It'll put the number in the appropriate spot. Plaque goes first, then mobility, and then bone loss. So if we have moderate plaque and we have mild bone loss and a mobility of 1, you'll see our numbers are corresponding for that one tooth. And again, that's if you scroll down on the data entry tab of your perio panel. Next, I want to show you some things that I think are fun, but before we do that, I'm going to save this exam. So again, right now, because it's not saved, it says new in parentheses in the upper toolbar there, or just above your toolbar. And I click Save Exam, that new goes away. That's how we know this exam has been saved. It's no longer an open active exam. So there are some cool patient education materials in the Perio chart that you may or may not be aware of. The first one, we're going to go to the toolbar at the top and we're going to click on View. I want to show you the graphic chart. This is really helpful for your patients, especially those that are visual, and the numbers don't necessarily mean a lot, but as the saying goes, a picture's worth 1,000 words. This does that. So I'm going to make this bigger so that everybody can see it. It allows you to see in a graph format where your patient's probe depths are landing. You can actually use these plus signs to zoom in on an area. So we're going to go and look at the patient's upper left quadrant right now. We can see here anything where the green is, that's a 1 to 3, that's where it's healthy. The actual probe depth of the patient is indicated by the yellow line. So anything greater than 3, you'll see this red line showing the difference between it. So the higher the number, the more red you will see on those probe depths. So you can tell your patient, If you see any red on those areas, that means that, you know, we're looking at signs of infection and periodontal disease. Those pockets are deep. You can talk to them about it, as well as bleeding and separation. So the little red circle and for bleeding and the yellow one for separation will be on those teeth as well. When you're done looking at that one quadrant, you can exit out of it by clicking on the minimize icon, and it brings you back to the full screen. You can look at one arch at a time, and again, go back and forth between the different areas. So if they have an area that is particularly rough, let's look at the patient's upper right. We can talk about that. You can see right here on tooth number 1, we had, I think we put 11 as the probe depth for that tooth. And you can see right here how much red is showing. And again, it's very visual for your patients. It really does help with case acceptance. So that's the first patient education tool. I'm going to exit out of this, and we're going to go into the exam comparison. So again, from your toolbar at the top, you're going to click on View, and we're going to go down to Exam Comparison. All of the exams that have been saved for this patient will be listed here, and you can compare as many as you'd like. I'm going to compare the last exam with the one that we just did today, and I'm going to click OK. And this allows you to see what's improved and what's gotten worse. So in this case, our patient, everything got worse. Every single probe depth got worse. It will be kind of a light, almost faded out red if it was a small change. If it was a significant change, it's going to be dark red. So again, you can talk about this with your patients. Maybe if you're laying groundwork today, saying, hey, patient, let's look at this next week. And if things don't improve or if they get worse, we're going to need to talk about something more extensive, like treating this. So that's a great tool for you. I'll show you what it looks like when things get better. So I'm going to compare an old exam I did for this patient with the one where things got better, and you're going to see green. So this is where you can start to celebrate for your patient. Look at all the improvement we had, patient, after we did your treatment. Things got so much better. And again, if it was slightly better, it'll be kind of a faded light green. It'll be a darker, brighter green if there's significant improvement. And you can see the dates of those exams right here. And the last couple of things that I'm going to show you are things that you may not be aware that you can access. And again, it all depends on the version of Dentrix that you're using, but most of the newer versions, if you go to your menu bar at the top, click on View, you can actually access your clinical notes panel while you're in the Perio chart. You can do a new clinical note, use your templates, or begin typing as you go. So that's something that's also helpful right when you're in the middle of charting, instead of having to leave the Perio chart and go to the patient chart to enter your notes. Love that feature. That always surprises a few. It will auto hide for you, and you'll know that it's auto hidden because this thumbtack icon is sideways. So if I take my cursor off and put it on something else, that clinical notes panel will auto hide. You'll still see down here in the lower left hand corner that tab is there. If I hover over it, that panel pops back up. If I want it for some reason to stay on top, I can choose to do that. I'm going to click on that thumbtack and see how it's upright. Now that means my clinical notes will always be on top. It's not going to auto hide no matter what I do, but it does make everything really small. So I actually really like the auto hide feature because it leaves the Perio chart the same size. And then again, you can just hover on that panel to bring it up and down. You can also access your patient's health history from here. If you click on the red cross, it takes you right to that patient's health history module. If you're in version 7 and higher, it would take you to the medical alerts in older versions. So hopefully you guys learned something fun today that you can take back to your office. If you have any questions, you can feel free to hang around. Again, this session was recorded, so I am going to upload it to our YouTube channel. So for all of you who are just joining in for today's session, you can check that out. I will send that to you guys, and I will also post a link to that on our Facebook page so you guys can access those as well. We have a couple questions, so I'm going to stop recording and then we'll take this time for some questions.